Hi everyone, this is Dr. Dev. I'm a Chief Medical Oncologist at Medicover Cancer Institute, Visakhapatnam. Today we are going to talk about lymphomas. So what are these lymphomas? So in our body we have different systems like a circulation system and different organs. Like that we do have something called lymphatic system. Lymphatic system which includes the lymphocytes, the lymph nodes, the lymphatic channels, the spleen, and etc. So, if the cancer arises from this lymphatic system, for example, lymph node or spleen or the lymphatic drainage system, then it is called lymphomas. Predominantly, these lymphatic systems are made up of the lymphocytes or WBCs, and these WBCs are very important in our body as a policeman because they provide immunity to us, they protect us from the microorganisms. For example, if there is a damage or anybody gets hurt in the fingers, the glands in the axilla or elbow get enlarged because of the reaction of lymphatic system. So these are called glands in normal terms or in layman terms, or in technical terms we call lymph node enlargement. So if the cancer affects these glands or lymph nodes, we call lymphomas. So there are different types of lymphomas. It's Hodgkin's lymphoma and non-Hodgkin's lymphoma broadly. And even in non-Hodgkin's lymphoma, we have various types of non-Hodgkin's lymphoma, like aggressive lymphomas like DLBCL, Burkitt's lymphoma, mediastinal lymphoma, etc. And slow-growing lymphomas are non-aggressive lymphomas. We have SLL, we have follicular lymphoma, marginal zone lymphoma, certain variants of mantle cell lymphoma, etc. and etc. So there are different kinds of lymphoma depending upon the site and the cell of origin in the glands. Now essentially, whatever is it a low grade or high grade, essentially the symptoms are these patients present to us with enlargement of the lymph nodes or glandular enlargement. They have fevers and they have night sweats, loss of weight and appetite. These are the common symptoms, or we call it as constitutional symptoms. And apart from that, in very advanced stage, they can have various other symptoms depending upon the organ involved. So if the patient comes to us with these symptoms, the first thing we do is we do an excisional biopsy of the lymph node. So like any other cancers, if we are suspecting lymphomas, we have to do a complete excision of the gland. We cannot do a true-cut biopsy, which we do like any other cancers. So this is very important. We will remove the complete lymph node, and then we would send it for the histopathological examination. And based upon the histopathological examination and IHC, that is immunohistochemistry, we would type the lymphoma, the type of lymphoma, whether it is low grade, high grade, Hodgkin's, non-Hodgkin's. Then for staging purpose, we do a PET CT, and the PET CT would tell us what stage it is it stage 1 or stage 4? And also we would do a bone marrow aspiration biopsy in certain conditions and a CSF analysis in certain conditions and other investigations if required. So we have done a biopsy to confirm the lymphoma, and we have done a PET CT to stage the lymphoma, and also we have done a basic investigations to look at the organ functions. Based upon the type of lymphoma and the stage of the lymphoma, we have different treatments. Essentially, we have the combination of chemotherapy and immunotherapy. For example, rituximab is a immunotherapy, and R-CHOP is the chemotherapy. So essentially, chemotherapy is the backbone of lymphomas, and sometimes we add immunotherapies or monoclonal antibodies to these. And the good thing is these lymphomas tend to respond very well. Almost 70 to 80% of these lymphomas can be cured, and if diagnosed at an early stage, even 90% of these lymphomas can be cured. So if anybody has any symptoms suggestive of what I described earlier, please visit us so that we could educate you more, or we would treat you if you are diagnosed with lymphoma. Thank you.